it's probably not your elbow that is the problem. If you've had elbow pain for 3, 6 plus months and it hasn't got better, it's not your elbow anymore. More often than not, it's not the elbow that causes the elbow pain as well. Usually it is the hand, the fingers, the wrist, the shoulder blade, the neck, and the thoracic spine. Even so much so that it's the mechanics of the breathing and the rib cage and the ability or inability of the rib cage to expand and contract efficiently as well. What that also means is that the pelvis and the orientation of the pelvis, the way the hips move, can also be contributing to your elbow pain. Addressing the hand, the wrist, and its function, the shoulder blade, and its relationship and articulation and rhythm on the rib cage with the humerus, around a thoracic spine that can twist, bend, flex, extend, and a cervical spine, a neck that can also do the same, all of its rotation, everything like that. I know this because I've had elbow pain for 20 years. I've been in clinical practice as a podiatrist for over a decade in sports rehab, injury management, sports performance, for a bit longer than that as well. And from the age of 14, I've experienced intermittently and chronically elbow pain. Golfer's elbow, tennis elbow, radial tunnel syndrome, cubital tunnel syndrome, distal biceps tendonitis, all the tendinitis, ganglion cysts, carpal tunnel syndrome, de Quervain synovitis of my thumb, all of them on both. And tried every treatment, every modality, every therapy, every hack, every recovery technique. And the thing that improved it the most was improving the way that the body functions as a system. How these body parts talk to each other in a relationship. After 20 years of lifting like a bodybuilder in very static, single plane range of motion, very isolating in nature, machines, barbells, those sort of things. When you isolate the body chronically for so long, parts stop talking to each other. When injuries occur, compensation begins, guarding patterns, dysfunction, imbalances between sides. And the way that you improve this is by returning back to the basics, the body weight movement, stretch strength, joint function, spine health, neck health. Because a lot of these injuries, while initially they start off as tissue, connective tissue, joint, ligament, tendon, muscle, pain, and inflammatory conditions, chronically turn into nerve issues as well. Because if initially the muscular tissue is inflamed for some reason, there's a dysfunction occurring somewhere, compensation and overloading of that tissue, chronically that means that whole system is out of whack, which means those nerves are going to have tension on them at different segments along the path from the spine into the extremities. As a podiatrist, you realize that over time, when you're working with people with injuries or in any clinical practice, the foot and the hand are much the same, the wrist and the ankle are much the same, the elbow and the knee are much the same, the shoulder and the hips are much the same, except the shoulders have a shoulder blade. But they all fundamentally need a baseline level of function and ability to express movement and tolerate load in a normal range of motion without restriction, to prevent these chronic long-term pains, dysfunctions, and never-ending cycles of